Okay. Well, once again, happy Friday, everyone. Welcome. Thank you so much for joining us for our Strengthening Protective Factors Through Home Visiting, a Child Welfare Perspective training. This training is hosted by the Consortium. If you're joining for the first time or might not be familiar, our home visiting consortium brings together more than 60 home visiting programs, family and child health organizations, and community partners. Together, we strengthen the LA County home visiting system through shared training and resources, research and data collection, improved referral pathways, and advocacy for policies that recognize the vital role of home visiting services in our county. If you're interested in joining our efforts or want to learn more about the consortium, you can always scan this beautiful QR code over here that will take you to our member page. Our membership is free, and we welcome all organizations who are involved with child and family health to join us. Just a few important housekeeping tasks before we get started. Just a reminder, this presentation is being recorded. The recording and materials will be sent out in a follow-up email to all those who registered and is attending. And then we also post all our trainings with the links to all our materials on our website after the training is complete. And then just a quick reminder, if you do have questions throughout this training, please use the Q&A box to engage with the speaker and post any questions you have on there. And then we also do kindly ask you to complete a really quick survey at the end of the webinar. It's really important to us to get feedback from you all to know what trainings we want to host next for you and what is most relevant in our field. All right. Well, with all that being said, I'm really excited today to present our speaker for this training, who is Melissa Miller, who's the Director of Child and Family Protective Services with the Health Group. A little bit about Melissa. Melissa is a licensed marriage and family therapist and received her master's degree in clinical psychology with an emphasis in marriage and family therapy from Pepperdine University. Throughout her career, Melissa has been working with children and families in various settings that have experienced trauma, abuse, and neglect in various settings and various capacities. Melissa's areas of expertise include early childhood and infant mental health, trauma, attachment, and reflective clinical practice. And she's passionate about empowering families and building strong parent-child relationships. For over a decade, Melissa has been overseeing child abuse prevention programs in LA County that focus on increasing protective factors and fostering healthy and safe parenting. Melissa, thank you so much for being with us this morning, and I will hand over the mic to you.
Thank you so much, Anna, for that introduction and hard staring at a picture of myself for that long. But thank you. I am going to attempt to share my PowerPoint and hope that it all works out. Okay. Am I sharing the right screen?
Yes, you are.
Okay, amazing. So thank you again. That's a little bit about me, and I think it's a good time to find out who is actually with us today. That's a good segue. So we have a quick poll or two to see who is joining us today. That helps me have an understanding of who I'm talking to. So that should have popped up for everyone. I think my screen looks different, but so what is your primary role? You might overlap into more than one of these, but kind of what do you most identify with? If you don't mind filling that one in, and then I don't know if everybody, when Laura, I'll let you man the poll.
Thank you, Melissa. Yeah, you have the big majority is home visitors, which is really wonderful, followed by social workers and child welfare. We have a few county employees here, and then some that also are from other fields. So it's very exciting. You got about 65% home visitors in the room.
Amazing. And that could be so many different home visiting models. So very cool.
All right, let's go ahead and move on to the next one. Oh, here, if you actually want to see the results. Sorry about that.
Yep.
Can everybody see it now? There we go. Okay, now let me pull up the next question for us.
So yeah, we have a couple different disciplines today. So how well do you know the protective factors? You may have never heard of it before, or you might have heard of it, or you live it every day. Um, just an idea.
Thank you all for completing a poll. We have a lot of people that know the basics, so you're going to learn a lot more about them today.
Awesome.
Let's close this
To
out in just a
go.
few more seconds, and then I'll share the results with everyone. All right, there you go.
Okay, perfect. So the basics. We are going to go a little past that. So hopefully you'll maybe be an expert by here, but mostly what I want to focus on today is, yes, what are the protective factors, but really tying that into home visiting. And we have a lot of home visitors here. This might be brand new, this might be a refresher, or um, somewhere in between. So um, we're going to talk about we're going to dive a little bit into what the home protective factors are, talking about home visiting as an intervention to improve protective factors and assessing protective capacity. So this is where we're going to go. So just broadly speaking, again, a lot of people know the basics. I like to kind of start broad and get down to specifics. So what are protective factors? For those that have never heard this or never really deal with this, in essence, protective factors help mitigate the risks of child abuse and neglect in vulnerable families. Protective factors go up, risk factors go down. So the protective factors framework was developed by the Center for the Study of Social Policy in 2004. The protective factors are defined as individual or environmental characteristics, conditions, or behaviors that reduce the effects of stressful life events, increase an individual's ability to avoid risks or hazards, and promote social emotional competence to thrive in all aspects of life. So we're talking today about looking at protective factors or using protective factors to look at home visiting from this child welfare lens. And so basically, in a nutshell, protective factors reduce the likelihood of child abuse and maltreatment. I like this visual. I stole this also from the internet, but I really like the idea of looking at risk factors as a buffer. I mean, protective factors as a buffer. So in this little image, the risk factors are raining down stress, substance abuse, poverty. These are just examples, obviously. And then the umbrella is our protective factors. And you can see the 5 there: parental resilience, nurturing and attachment, knowledge of parenting and child development, concrete support in times of need, social connection, social emotional competence. And the umbrella is like buffering the family against these risk factors. I also like to think of protective factors of maybe even like a raincoat, because they can be really individualized for every person in a family. As you might know, like 2 siblings might grow up in the same household and their resilience level is totally different. So again, it's just the idea of protective factors buffering people from the risks. So just a little bit more about what like the approach that we take here with protective factors here. So in the past, child maltreatment prevention and intervention strategies focus on eliminating risk factors. So when we have this risk-focused perspective, like minimizing teen pregnancy or minimizing or reducing substance use, right? Removing the risk. What's wrong with that is first of all, it pathologizes the individual, right? This is they are more likely to feel stigmatized, like it's something that they did. There might be more judged about it, right? And most importantly, like we can't always remove risks. We can't always remove mental illness. We might not even be able to remove poverty, right? So it really takes kind of um, away the ability to like do focus on solutions, because we can't always necessarily change those risks. When we look at these individual risk factors, we also aren't addressing like larger systemic issues or structural issues. It's all about what could that person do or have done differently. And on the flip side, not all families with risk factors experience abuse. And sometimes there's a lot of families that are seemingly in low risk situations that do experience abuse. So it's really not about how can we get rid of risk factors? it's really about how can we help to buffer them, right? So this is why we're looking at focusing on protective factors. Another example I like to bring in this time too is talking about like risk factors and buffering, and what is a very common, I think, especially if you're in this world, right, is the conversation around ACEs. So ACEs, which stands for Adverse Childhood Experiences. Um, Many of us have heard about ACEs, but I don't know if everybody knows actually like the ACEs study. And if you do, here's a refresher. So basically, there's a questionnaire. It's a 10-point questionnaire that has 10 different adverse childhood experiences, like situations or circumstances or events that occurred to an individual before they turned the age of 18. Divorce, abuse, mental health issue, apparent mental health issues or substance abuse, um, other like kind of like family dysfunction, basically. And each ACE that you've had is like a point, right? So you could have anywhere from 0 to 10 of an ACE score. So they utilized this questionnaire. There was a study back in the 90s out of San Diego, and it was through Kaiser. It was over 17,000 people that they did this study with, and more than a quarter of them had at least one ACE score, right? 1 point, and more than 12% of them had at least 4 or more. So what they learned from the ACEs study, because again, this is through Kaiser, they're looking at healthcare, is the more ACEs, the greater the likelihood of chronic medical issues like diabetes or obesity, and mental illness and substance abuse in adulthood. This wasn't diagnostic or anything, but it helped establish a link between childhood trauma and long-term health problems. That's basically what it was used for. Something to make a note about is in that study back then, it's important to know also, just to paint a picture, that 75% of those participants were white, and more than 70% of those individuals had some level of college education or higher. So it gives you a little picture of the population they were utilizing, and think of the population that we serve in our home visiting programs. If this happens in the majority population, so to speak, you can imagine the families that are immigrant population, minorities, or others that have experienced trauma and other types of challenges. So this is like kind of like what their baseline was. So I think that's really interesting to add to that. So you can just imagine the ACEs that our families are coming to, right? Especially in home visiting with the parents. ACEs are still used today. The screening is still used today. Some of you might use those right now, right? But I like to think of like, what do we do with that? We've just now said, like, thanks for pointing out all these horrible things I did in my childhood or experience. Now what? Right? We can't go back and change them, right? This is why we can't eliminate risk factors. We can't change things that have happened or the circumstances someone grew up in. But how can we build resiliency despite these experiences, right? And with the ACEs, we want to provide opportunities to buffer individuals from these potentially harmful effects. So this is what we're talking about with protective factors and keeping children safe, right? In essence, what can we put in place to prevent children now from experiencing ACEs? This is why we want to focus on protective factors, because we are buffering those kids from developing more higher ACE scores and later on challenges in adulthood. So hopefully that paints a little bit of a picture. I know ACEs sometimes is widely used, so just crossing some bridges here. And so we're going to talk more about what the protective factors are, but really what the goals are is that they emphasize strength, they identify areas for growth, they help build resilience and develop skills to offset risk exposure. This is really the main key, is what are we doing or what can we put in place to offset risk exposure? Because we're not going to be able to always get rid of the risks. This leads to short and long-term positive outcomes, right? Things in the moment, things hopefully long-term. And protective factors can be impacted on lots of different levels. So hopefully you're with me. I know that's a lot. And again, if there's any burning questions in the chat, please interrupt me. So if we're good, I'm going to keep trucking along here. So talking about looking at protective factors or prevention on different levels. So I want us to look at prevention from a social ecological model. So this is basically a framework for understanding how multiple factors influence health outcomes and behaviors. It suggests that intervention should be addressed at these different levels to be effective. So the individual level is personal factors that influence behavior. The relationship level, which let me advance, I forgot to put animation in here. So individual protective factors. This is my stress management. These are just examples, of course, but stress management, access to concrete support, hopefulness, I have ability to problem solve, resilience, and my own parenting skills, right? So individual level. Then there's the relational level, which is the close relationships that influence risk. So relationships with peers that reduce feelings of isolation, positive relationships with extended family, ability to communicate effectively. Maybe you're involved in your church or other social groups, and parent-child relationships. A community level of prevention here and protective factors. This is where social relationships occur, right? So community norms of a shared responsibility for supporting parents and families, implementation of evidence-based practices, access to basic needs and specialized services. So you can see these different levels. The community is like really where we come in. What's not on this visual, but also the fourth level, is the societal level, which is the broad cultural, social, economic factors, which is like social and cultural norms, right? Like above us here in LA County, right? California, the US, whatever. So this is social, cultural norms, racial inequities, policies, and legislation. So that's really like the next level here, but we're focusing kind of these three for now. We're going to talk more about, again, where we all fit in this model, but maybe your wheels are starting to turn. Before we go back to this, I want to now, we've been dancing around what the protective factors are. So I want to get into defining them. So everybody has said they have sort of some basic knowledge of them, which is great. So this might be a little bit of a review. So these are the five. Like if you were to Google what are the protective factors, these are the five nationally recognized protective factors. The first one is parental resilience. Managing stress, and the definition, I'm going to define them first. Managing stress and functioning well when faced with challenges, adversity, and trauma. Basically, like resilience in any context is basically the ability to bounce back, right? Pulling from your inner strength, utilizing your coping strategies. What do you need to do for yourself, or what skills do you draw on to get through your daily stressors? How you get yourself out of bed every day, right? This is your ability to solve problems and be resourceful. This is my ability to ask for help when needed, which I know can be hard for some people. And this is like basically how do they show up for themselves and for their children, right? If there is an individual that's super depressed and they can't get out of bed, or they're kind of bogged down by that trauma that they're experiencing, they might not be present for their children, right? So again, this looks a little bit different for everybody. That's why I call it a rain jacket maybe instead of an umbrella, because that looks a little different for everybody. The next one is social connections. Positive relationships that provide emotional, informational, instrumental, and spiritual support. So this is relationships, right? So having trusting relationships. I want to emphasize that not all relationships are positive. You would probably know that just in your own life. Is you might have a big old family, you might have a bunch of friends, but they might not be people who buffer your stress. They might contribute to your stress, right? So again, people that you can lean on for support in all different ways. Maybe this is the person I go to for emotional support and who I can vent. This is the person I go to just sort of like bounce an idea off of them. This is who I go to if maybe I'm going to be strapped for money this month, right? Like it all falls under these different types of relationships that serve as a buffer for stress. And as we know, social connections help people feel less isolated. When individuals are isolated, that's when we're in a little bit of a danger zone for some risky behaviors, basically. The next one, knowledge of parenting and child development. Understanding child development and parenting strategies that support physical, cognitive, language, social, and emotional development. This one probably seems pretty straightforward, especially since we're in a predominantly home visiting crowd over here, but this is helping the parent understand their child's development, their developmental milestones, helping them be attuned to their child's individual needs, recognizing that this child and my other child, I have to parent them differently, right? They have different temperaments. I have realistic expectations of them based on their developmental stage, their age, right? Their capacity. I know I need to have different discipline strategies or, you know, parenting approaches for my 3-year-old versus my 12-year-old, right? So again, being able to cater that parenting to that individual child needs, capacity, development, and appropriate discipline strategies, and also helping to support child development, right? This is helping them with their language development and social development, right? So this is the parent coming in and contributing to that and having parenting skills and helping to support their child's development. The next one is concrete support in times of need. So this is access to concrete support and services that address a family's need and help minimize stress caused by challenges. I realize we define the word with the word, but basic needs, right? We're talking food, shelter, clothing. If you know Maslow's hierarchy in need, it's that bottom level meeting your physiological needs, right? Does this family have what they need for themselves and their children? And if they don't have it, they know where to go, right? So it doesn't mean I have everything in the world, but I know that this is where I can go get diapers. This is where my food banks are. This is where they give donated clothing, right? So it's not only I'm aware I have it, but I'm aware of where I can get it. And the last one is social emotional competence of children. So this is really this relational component. Family and child interactions that help children develop the ability to communicate clearly, recognize and regulate their emotions, and establish and maintain relationships. So again, this is the parent being able to help foster that in their child by modeling their own healthy communication, boundaries, emotional vocabulary, right? It's okay to cry and being there and being present for that. This is what is going to help create secure attachments. This is also going to set the tone for how that child later develops relationships with other people, right? This is what comes in here also is regulation and co-regulation. That's falling under this category. So I don't know if there's any questions yet, again, about anything I've covered so far, but this is what I guess you could say define. We're gonna connect the dots to home visiting in a bit, but just checking in real quick.
Yeah, you did get one question that came through. It was related to ACEs and community protective factors. Someone
Oh, yeah.
asked, can you touch on community adverse experiences as well that have been added since the initial ACE studies?
Community adverse experiences. I don't know if they've actually updated an ACE questionnaire to include that, but that is something I've heard about in conversations around like community trauma, violence in your community. A lot of that isn't necessarily happening in your household, right? And I think that is on that would I guess on the model there with the different levels on the community level, right? Community violence, um, the impacts of violence, I think, in neighborhoods, right? And how the protective factor around that is by providers like us, right? Being able to provide resources, providing education and support to be able to help, again, offset those. Some of our families live in violent neighborhoods. We live in a violent country. This is just the reality of it, right? So, again, that's again policies, legislation. What is there things being put in place to counteract those types of environmental traumas? I don't know if that answered the question, but that's what comes to mind when I hear that community level.
Perfect. Thank you. That was the only question so far.
Okay. So thank you for that question, by the way. That was a great question because, yes, I think it is so much more than what happens inside a home. So that's a really important part. So talking about what's happening in the home, I'm going to segue into home visiting specifically and start connecting those dots. And I want to just, again, this is not going to be brand new information. This is just to help to change the lens a little bit or to just add another perspective. So we're just building kind of that child welfare, child protective lens, because so much of what we do, we might not even realize we're doing prevention. We do a fun event in the community, we're dosing that community with prevention, and they might not even know. They're coming to our Halloween events, right? They're coming to our parent classes that are free. Um, they're coming to a resource fair because they happen to be in the park that day, right? These are all doses of prevention that we do, and we might not even be realizing we're hitting one of these protective factors, or we're being in that social ecological model where we're fitting in, right? So again, just a perspective. So home visiting, preaching to the choir here. What for those that are not in home visiting, right? Thank you to the consortium for providing this definition. The Home Visiting Consortium defines home visiting as perinatal and early childhood home visiting, which is a multidisciplinary family-centered support strategy with services delivered by trained professionals in the home. Home visiting is offered on a voluntary basis to pregnant women. I added expectant parents because maybe it's fathers, and or families with children through the age of 5. Home visiting provides a comprehensive array of holistic, strength-based services that promote parent and child physical and mental health, bonding and attachment, confidence and self-sufficiency, optimizes infant-child development by building positive, empathetic, and supportive relationships with families, and reinforcing nurturing relationships between parents and children. Some of this lingo already sounds like protective factors, right? Now that it's fresh in your mind. And home visiting is designed to empower parents to achieve specific outcomes, which may include healthy pregnancy, birth and infancy, optimal infant and child development, school readiness, and prevention of adverse childhood experiences. So again, it might already be connecting for you too, right? Some of these words are almost direct. So as we know, there are several models of home visiting in LA County. We probably have the whole spectrum represented in this group. Each model, for those that aren't aware, each model may have a slightly different target population. Yes, we're working with expectant parents, children through the age of 5, but there's nuances in that. So a slightly different target population or different qualifying criteria, right? Each model might have slightly different goals and that might depend on the outcomes, right? In our Partnerships for Families program, which is the home visiting that I'm connected to, it's funded by Department of Children and Family Services. So our overarching goals are child safety, right? Keeping the family intact, that parent-child relationship, versus maybe early Head Start is maybe focused on pre-K readiness, right? Again, not that we don't all care about all of these things, we just might have different focuses based on our funding sources and the particular outcomes we're going for. Also, home visitors are not all one and the same, right? Some of our home visitors are nurses, some of them are parent educators, sometimes they're therapists. So there's different backgrounds of the home visitor as well. So I'm going to talk in generalities about how home visiting contributes to protective factors, because there is so much overlap in our programs. Despite these nuances, there's so much similarity, and we're really targeting very similar goals, really, in the scheme of things, right? So your specific home visiting model might target something else. These are just sort of baseline examples, right? Of how home visiting can be seen or can be used as an intervention to increase protective factors. So we're going to go one by one through here. And again, these are just examples, and your model might do something even above and beyond this, but this is a commonality across all models to the best of my knowledge. So parent resilience, just because you might not have memorized it, here's a definition again: managing stress and functioning well when faced with challenges, adversity, and trauma. How do we target this in home visiting? We're helping them learn coping strategies and other self-management strategies. We provide psychoeducation and skill building, right? Having somebody to come and talk every day about how do they manage their multiple children, how are they, literally, you might be talking about coping strategies, right? If there's a mental health component, managing their stress, helping them with a routine, knowing where to go to ask for help, right? Education about their own challenges, right? Also in at least in our work in PFF, where we work with high risk families, we encounter, which were not unique to the other models, is a lot of domestic violence, educating about relationships and how do they set boundaries with others, right? And just general skill building. So this is across the board what's incorporated into home visiting. Social connections. Again, these are positive relationships that provide emotional, informational, instrumental, and spiritual support. How does home visiting do that, right? First of all, you're a built-in support system, but we're not going to be there forever. Some of our models are super short term. Some of them are lucky to be with them maybe 3 years, which is amazing. But also, fundamentally, we are a support and we're a social connection. But part of what we also do is help them identify other support systems, right? You're talking about the sister, the mom, the friend, the mommy and me groups, whatever we can do to connect them with other moms or other people in their lives of who they can lean on to get support, right? Many of our home visiting models like literally incorporate social connections or group connections, as part of the program model, which is amazing because, right, we're targeting these social connections. It's helping to reduce that isolation, helps to normalize the experience. Ideally, they get to connect with each other and maybe they live in a similar neighborhood or they're not too far and their relationship can extend outside of the group that you're offering, right? You're doing a infant massage class, they get to see and talk to other moms with babies in a similar age group, normalizes their experience. There's this just built-in sense of like I'm not alone in this. That's really what we're targeting, right? In addition to that sense of I'm not the only one going through this. You understand what I'm saying, right? You understand where I'm coming from. We all can recognize parenting a little one is really hard and navigating life and all these things we just talked about with our environmental stressors, right? It helps to talk to somebody about it, whether it's you for the short term or best case, you get them to long-term support or help them to recognize who can be a support system, right? It's very inherent, I think, in home visiting, even though you might not even think of it necessarily when you're coming to the home and you're like, how action one in their home, right? But so the next one, knowledge of parenting and child development, again, I think is probably the most straightforward when you think I think is under support full cognitive understand ABQ. They're learning about their infant and child development. Some of that is like the main focus of some of the models, right? Is truly just getting in on this development readiness, early education, literacy, teaching them to like read to your baby, talk to your baby, um, interact with your baby, model that language development. This is what this crying looks like compared to this crying. And then parent strategies, behavior management for those that are working maybe the higher range of up to 5, or we're talking tantrums and other behaviors, right? This is all part of this. And I think one of the ones that I really think is so important is encouraging parental mastery and confidence. Like I think of like an infant massage, right? When they learn how to finally soothe their baby, it's such a magical moment where they're like, I can do this, right? So being able to give them this information and be there modeling and coaching them through that, I think it really is pretty profound. The next one, concrete support in times of need. Again, this is access to basic family needs. As far as I know, well, first of all home visiting services are free. We already established that, so we're eliminating a cost for them as well. As far as I know, probably all of our programs will provide diapers at some point. Maybe other baby items, right? Maybe they get car seats or bassinets or wipes, whatever, right? So a lot of times home visiting just kind of has that component built in where we have access, right? A lot of us have baby to baby partnerships, all of that. So we get supplies because we know how much a family with children at this stage need, right? And a lot of times we are doing a lot of case management with these families, right? We are linking them to Friday, or this is where the food pantry is, or they do fresh produce here, right? Like we're linking them too. So again, it's not just I'm giving you everything you need, I'm teaching you where you can go because we're not going to be around forever. So that is all concrete support. And one of the things I pointed out that maybe is not as like coming straight to mind is a lot of us might, through this parent education, learn ways to engage with their child, with their children, with things they have lying around the house, right? We don't encourage them to go buy fancy toys. They might have some items lying around the house that they can help and just keep their children engaged, interact with their child, promote their brain development, right? With things that don't cost any money or things that they already have lying around. So I think that's an interesting lens also to look at something like that's helping their concrete, like helping with concrete support, basically. We're not creating costs for them and providing them with access. So the last one is social emotional competence of children. And again, this one is family and child interactions that help children develop the ability to communicate clearly, recognize and regulate their emotions, and establish and maintain relationships. What do we do about that? We are promoting bonding and secure attachment. Um, Again, I talk a lot about infant massage because I love it, but infant massage does all these things. This is like the mega one for this, right? Bonding, attachment, emotional regulation, physical regulation for that matter too. Communication strategies, healthy relationships. I was mentioning also with if there's parents that we work with that have been in or currently in domestic violence, helping to educate those of modeling what healthy relationships are and healthy communication within their family. How do they want to be treated? How do they want their children to be treated, right? All of these things come up and they are promoting this long-term they're planting these seeds later that are going to blossom hopefully into their child growing up and having healthy and secure relationships with other people. So this is modeling that, and it starts with that co-regulation. I know that's a big one also in this work is co-regulating. I'm not going to be able to help this baby, or I'm not going to help my child through their tantrum if I'm up to here, right? I need to calm myself down and then we can co-regulate together. And that is what that um, is protective factor that we're talking about here. Because again, really what we're looking at is how can we give the parents skills and help to them reduce their stress so they are less likely to engage in risky behaviors with their children. Basically, engage in potential child maltreatment or neglect, right? What tools are we giving them? What education are we providing them? How can they manage themselves, right? Because a stressed parent around a behavioral child could be a bad combination, right? So this is what we're talking about of what can we put in place. We are trying to buffer the internal and external stressors of this family so we can help to protect the children and maintain a safe home environment. So hopefully these are wires are starting to cross and see kind of what the big picture is. I do want us to bring us back to that ecological model now that we're talking specifically about home visiting. So here we are again, talking about where now does specifically home visiting fit in this model. So on the individual level, like what we were just talking about, we're talking about stress management and coping strategies, emotional regulation, parental mastery, they're learning parenting skills, they're understanding their child's development or supporting their child's development. That's that individual. That's a choice they're making. That's something they're learning and a choice they're making to create safety for their child, right? And that is happening. All of that is one-on-one and home visiting, right? Um, Relational, we are talking now between two, right? The secure parent-child relationship, obviously home visiting is supporting that for sure. Effective communication, co-parenting. Um, we, I, I can't not talk about dads here also, right? So from that is a whole talk, and I'm sure you've all gone to lots of presentations on father engagement and home visiting specifically. But again, I'm going to come from this DCFS perspective or child welfare perspective, that also engaging dads helps further DCFS's mission, right? There is such an issue, particularly within child protective services, where fathers perpetually are absent or they need to jump through so many hoops, right, to have access or have a relationship with their child. But hopefully, if we can engage dads early on through early intervention programs like home visiting, right? If there's a dad around, bring him in. Then we can hopefully provide dads with the opportunity to reap the benefits of home visiting, improve those relationships, be attuned and safe parents, right? We're trying to reduce the stigma here, right? And this preconceived notions that dads are not nurturing parents, right? And maybe contribute in some way to reducing the trend of absentee fathers in DCFS, right? Hopefully, if we're in early intervention, this family's not making it to DCFS, but again, what we can do. So individually, those dads get to reap those benefits. Relationally, right? We're talking co-parenting. So much happens where there is strife between the parents, and that's when DCFS is getting involved, and then one parent tends to get isolated, right? So just really helping the co-parenting relationship if that partner can participate in home visiting. And then again, your home visiting programs that offer social connections or group connections, whatever they're called, helps to reduce isolation. On the community level, um, we are so lucky in LA County that we have so many home visiting models available throughout the entire county. We have father engagement initiatives, right? We are in this space together, right? This is a community protective factor. We are learning and expanding our knowledge and our capacity to better serve families at this level. So I don't know how to put my cursor there, but that's where we are right now, just in this space alone, right? And then, of course, from like a societal level, the fourth bubble that is not on here is funding, legislation, right? Keeping home visiting going and valuing that in our country and our society, that early intervention is important. So just sort of, again, another crosswalk for you to kind of explore this perspective, So hopefully, I don't know also if I need to pause if there's any questions or anything that came up, because I'm going to sort of switch gears ever so slightly.
Oh, no questions yet.
Okay, perfect. So now that we've talked about what factors are, we're looking at home visiting from this protective factors lens. I want to talk about, like, how do we know it's working? How do we measure protective factors? How can we see it, right? So basically, now I want to talk about kind of how do we measure this? So protective factors can be measured in a lot of different ways. There's formal ways and informal ways. So one of the things I want to mention is, if you're interested, for those that love data, for those that love standardized tools, there is one. So there are protective factors surveys that exist. They were developed by FRIENDS, which is an acronym: Family Resource Information Education and Network Development Service, National Center for Community-Based Child Abuse Prevention. That is a mouthful for an organization's name. We'll call them FRIENDS. So FRIENDS developed this tool. I'm not exactly sure what state they're in. I want to say it's something like Midwest, mid-country-ish, so not in California. So they created this tool, and it is an evidence-based tool. If you love a validated tool and you want to incorporate these into your program, sure, right? With caution, right? It provides just a snapshot of families. It can measure changes in protective factors, and it can help identify areas where the staff can focus on. Again, I say proceed with caution because it's not the best. I'm not sponsoring this in any way or condoning it. I'm just giving resource at this stage. So first, I want to mention before kind of the flip side of it. So there's two versions of it. There's the original protective factor survey, and that is a true pre and post test. And the way it's scored, it basically shows kind of where their protective factors are at. Like, it's kind of like a functioning level, right? The different strengths. And then when they end services, there's a post survey, and then you can hopefully see progress, right? Then they created the PFS2, which is a retrospective survey, where it's intended to only be done at the end of services, just once at the end. And it is an embedded pre and post. So basically, with the questionnaire, they'll say, reflect on the time before you had this service. What was it like? And now that you've been with us, what is it like? And so it's an embedded pre and post. So I guess the benefit of that is sometimes our participants disappear before we can do a post survey, right? If anybody does outcome measures, sometimes they disappear and you never get that second survey. So the retrospective in theory could help solve that, where they only do it at the end of services. So it sounds great, right? Yeah, sounds great. Again, I don't work for Friends and I don't know anybody there, so nothing against anybody there, but there's some flaws, right? Um, the tool itself is a little confusing. It's very lengthy. It's a couple pages. And it's a lot of scaled questions, but like the scale changes multiple times. So it's a agree to disagree, it's a likely to very likely, like, that kinds of thing. So that's just confusing. There is a Spanish version, but I've heard the Spanish translation isn't great. It's a bit subjective, meaning, and it's a little confusing. So meaning like if you ask these questions in that exact moment, it depends on how that family's feeling. That's in our experience. So it might not be a good reflection of your outcomes. I would not recommend using this tool to measure your program outcomes or your effectiveness of services. It's truly just to get a snapshot of kind of how people are identifying and targeting protective factors. So again, proceed with caution. However, if you are interested in being like, what is she talking about? It can't be that bad. Take a look. This QR code takes you right to the Friends website where you can download all the surveys and the manuals. And again, it might just be informative, but I just caution about looking at it from an outcomes perspective, because it it doesn't necessarily reflect what you're doing necessarily, especially if they're on a great trend and then like they somebody loses a job, the scores could look really worse than they started with, and that has nothing to do with us, right? So anyways, it's just my job to offer some ideas and resources. So that's one. So it might not be the best way to measure protective factors. So you're saying, well, then what do we do if you don't recommend this? Maybe informally, right? So that leads me to protective capacity. So if any of you, most likely, have worked with a family that is involved in the DCFS system in any capacity, you've probably had a social worker reach out to you to see how they're doing, right? And really what they want to know is like, do you have any safety concerns? How do we answer this, right? This is where protective capacity comes in, because it isn't super measurable. It's subjective for sure. But what we can look at is observable behaviors or actions that the caregiver takes to keep their child safe. So this is what's going to be able to gauge if somebody were to reach out to you and say, do you have any safety concerns about this family or this parent? This is maybe the framework to kind of think about. I remember years ago, there was like in a presentation with somebody from DCFS. I'm not sure if they still do this training actually, but they were talking about protective capacity and what safety is, um, versus what safety is not. And I don't know if all social workers have this mentality, but I think it's a good framework for us. And I think some of us that are not in as a social worker, maybe it's little bit easier for us to recognize this. But I really actually like this thought of this mentality. Safety is not service compliance, linkage to services, or willingness to participate. You see a lot of, you probably have, where they're like, oh, did they agree to services? Okay, sure. Can you get a letter? Can I have a participation letter? And again, this is nothing, social workers, they're doing their job and they're doing hard work, and I don't envy them anyway. But again, we all need to have this shared understanding that safety is not compliance, right? Just because they're in your program doesn't mean they're new people, right? Somebody could go to a 52-week anchor management class, but if they have taken nothing away, they're not on camera, they're not doing the homework, I'm not sure if they're a safer parent, right? So again, looking at safety as acts of protection, meaning behavioral changes demonstrated over time that mitigate danger or harm. What are they actually doing differently versus what are they just like involved in? And again, not that your services, like them being in your services, yes, they're in compliance, I guess you could say, but our services are voluntary. Our services are they have to be on board with it because they can drop out at any time. No one's holding them to it. And that's really where we're going to be noticing behavioral changes. If they're going to go and meet with us every week and let us in their home, they're going to be taking something hopefully away from this, right? So again, this is a framework, or I don't know if it's officially what defines a framework, but this is a mentality, right? And also I want to point out strengths, because sometimes we think of like, oh, this family has so many strengths. And yeah, we all do. Everybody has strengths. When we are in the most dire situations, somebody who has a history of making poor choices, whatever the case may be, there's always strengths to draw on, right? And I want to make a little bit of a distinction between strengths and protective capacity. So we love a visual here. So I kind of have this like a bit of a crosswalk that I created of what could be seen as a strength versus protective capacity and what protective factor it's tied into. Again, these are totally just examples. This is not an exhaustive list at all, but just examples. So for example, this strength, this parent is motivated to maintain sobriety. We're in the realm of parental resilience, right? Motivated to maintain sobriety doesn't tell me what they're doing, right? Protective capacity means they're regularly attending meetings. They're setting boundaries with their friends and families from kind of their days of using, right? They're passing regular drug tests, right? So these are tangible acts of that we can observe to say this parent is doing this and making changes. Hopefully this is making sense. Another example, we're going to talk about social connections, right? How would we conceive this social connection? This parent is connected to friends and family. Again, they might have 17 siblings and amazing friends and this, cousins galore. That doesn't mean that they have social support, right? But this person has regular phone calls. Her sister's her go-to. That's who she leans on, right? There's an example of somebody, and I call her weekly or anytime I need her, that kind of thing, right? Maybe this parent attends church regularly, so they have that built-in support group. Maybe they actively participate in a regular mommy and me group, right? So again, it's what are the acts of protection that they're engaging in, the behavioral changes or the things that they're doing differently to demonstrate this protective factor. Hopefully, again, this is making sense in some way. Knowledge of parenting and child development. This parent is really understanding of their child's special needs. For sure, that's great. They're an advocate, they're a support, great. What are they doing, right? They maintain realistic expectations of their abilities, right? They know this child's limitations and they parent differently to this child than their other child who doesn't have those disabilities, maybe, right? Again, these are just examples. Um, the parent practices language development while they're driving to school every morning. They're not sitting silent in the car and not talking, like they're making active steps to promote this child's language development. They have a child with ADHD and they don't want to continue to scream at their child and the kid to keep getting in trouble. So they created a visual chore chart, right? Things like this. What are they engaging and learning and taking away and doing different to demonstrate this protective factors in place? Concrete support. This parent's super resourceful in getting the baby items for their child. They might attend weekly diaper events. They utilize their Facebook groups. They make their own baby purees, so it saves on grocery costs, right? Again, these are examples of what they are actually doing to help demonstrate that their concrete support protective factor is being met, right? This also might mean that they have a relative who they have a relationship where they can lean on, it'll look different for everybody. And then lastly, in the realm of social emotional competence of children, this parent wants to break the cycle of abuse she experienced in her family. Lovely. That's great. What is she going to do different this time? She practices co-regulation with her child using infant massage. She enrolled in PCIT because she wants to improve her relationship and her attachment. She just demonstrates patience when the child is upset. She's not flying off the handle or whatever the case is, right? She's practicing her own regulation strategy so she can be a safer parent when this child is behavioral, right? So again, hopefully this helps paint a picture. We kind of brought it all around, like broad down to specifics. And as us in this home visiting world, right, how can we see what we're doing first of all, we already knew there was a lot of juicy benefits of home visiting. We all wouldn't be here if that wasn't the case, right? But again, we're just talking about looking at it from this lens. of child safety, child welfare, child protection. And yeah, so hopefully this has been helpful. That might have been a lot of information that was brand new or refresher, but hopefully you find it helpful. I don't know if any questions came up in the chat or if anybody else has just things to say.
No other questions, but your point about the difference between strength and protective factors was resonating with people. Um, yeah, any other questions anyone has for Melissa? We can put those in, if you want to put them in the Q&A.
I also like silenced the chat wall because I knew I get distracted easily, so I can unshow that if I need to, or I can stop sharing. This is just my contact info, which is not a secret if anybody wants to follow up in any way.
Perfect. Yep, you're getting a lot of love in the chat over here.
Thank you guys.
So much, Melissa, for joining us this morning. Just a friendly reminder for you all who are still on the call. If you know anything about the consortium, we do love our surveys and our evaluations. So if you can just scan the QR code, um, it will only take you 5 minutes, I promise. But other than that, just wanted to remind everyone this is recorded. We will share the slides. We do upload all of our materials on our website, and I will be sending a follow-up email early next week. So thank you so much, everyone. And thank you, Melissa, for your amazing presentation.
Thank you. I did see a couple things now that I'm not sharing that came up in the Q&A. If there's time, I'm happy to stay and
Oh yeah, definitely. Thank you. Thank you for calling that out.
um, let's see. Strength is a noun while safety, protective factor is a verb. That's interesting thought. I guess this is a question. When DCFS is investigating, how do they tease out the client's strengths and their protective capacities? Do most social workers with DCFS see it through that lens? That is a great question. I hope so. I hope maybe we can share this information with them. That's why I was saying, like, I don't know if everybody has that lens of what I continue to see, unfortunately, is still an over reliance and an overemphasis on compliance. Despite this information, that part of which I got directly from DCFS at some point. So I would love to have social workers, all of them, I should say, because there's probably plenty that do, but see it from this lens. So I guess the question is, I don't know, and I would love if anybody from DCFS could weigh in. What suggestions would you share for the new parent educators? That's a broad question. Just in general or on this, I guess. I think wow, so much. I think it's just hopefully taking this information. You guys are going to get these slides. You're welcome to them to be able to kind of refer back to them. But maybe the main thing again is being able to see how what the family is doing, I guess, right? I think that's what it is we are allowing space for the family to show you what their capacity is. I think we come in and we educate, but we want to be able to see them either replicate it or share it back to you in some way, or demonstrate it, right? Revisit it later on and be like, how is that going? Or look on that. So yeah, that's not a great answer, but give them a chance to show you, I guess.
Melissa, there was a question in the chat that just asked if we could share your contact information again.
Oh yeah, should I put my email in the chat?
Yeah, that would be great. Thank you.
Okay.
Here you go, Guadalupe. Thank you for asking.
And thank you, Charisse, in the chat that DCFS focuses on parents' access protection over time rather than compliance with services. I know Charisse is very in the birth to 5 world at DCFS, and that's the goal, right? For everyone to have that mentality. And I'm happy that that's circulating through there. So,
You did get one more question in the Q&A from Catherine. Are you able to see it, Melissa, or would you like me to read it?
oh yeah, how do we mirror these protective capacities to our families when we see them act in them? How do we encourage them to try new protective capacities? I mean, I think being able to provide reflection, I think, is going to be really important of pointing it out and drawing that attention, right? Being able to point out what you're seeing and making that connection for them, right? The more you learn about your own regulation, the more you'll be able to manage your own behavior and keep your child safe, right? I think helping to connect those dots for them, I think, is important. And we always want to reward everybody in the moment, right? That goes, I think that's that parallel process, right? With kids, we talk about like reward them, catch them doing something good, right? Reward them in the moment. I think adults need that also, right? For us to be able to point out in the moment of like, you did a really great job with that. And then being able to explain why that was so helpful. So hopefully that answered that question. Oh, I just realized when I typed my email, it only went to you guys. Let me do that again. You don't need that. There we go. So thank you all again. I appreciate your time and listening, and I hope it was helpful. And even if it was a refresher, it just helps to have a good reminder. So thank you all, and thank you to the consortium for inviting me and letting me talk for an hour.